Anterolateral tract system. We have anterior column and lateral column. Free nerve endings are pain and thermal receptors. Muscles are divided in three categories, A, B, and C, according to their myelination. A fibers are more myelinated than B. C fibers are not myelinated. A fibers are subdivided in alpha, beta, and delta, gamma. Alpha is the fastest. Pain sensation goes with two fibers, A delta pathway and C fibers. Fast pain like pinprick goes with alpha fibers, while slow diffused pain goes with C fiber. Fast pain is perceived by the brain in 0.1 second. Slow pain can be felt after an hour. Thermal pathways are like pain pathway. We will find mediators on the pain area like bradykinin, histamine, acids, or potassium. These chemicals come out and stimulate the free nerve endings. Substance P, which is a peptide, and prostaglandins reduce pain. When nerve endings are stimulated, action potential goes to the first order dorsal root ganglion. Fiber from here will go to the dorsal gray horn and terminate in substantia gelatinosa. Here the second order neurons are located. Their axons goes to the central lateral side and cross each other. Dorsal tract of Leesor. When tracts from dorsal root ganglion enter in the gray horn, they go up and down. When going downwards, they make a local tract called dorsal tract of Leesor and terminate at substantia gelatinosa. Now after the tract cross each other, they will go to the lateral side and start moving upward. But here the difference is, as they are moving upward, the upper tracts are coming in and joining them inside. Means the lower part tracts are the outermost than the upper part tracts. Laterospinothalamic tracts, as we know them, they deal with pain and temperature. Crude touch pathway. Fiber comes from the dorsal root ganglion. They also go to the second order nuclei. After the second order nuclei, the axon crosses each other but go to the anterior or lowest most part of the spinal cord and then ascend. This pathway is called anterior spinothalamic tracts. Spinotactal pathway is going upward between lateral and anterior spinothalamic pathway. This pathway controls spino-visual responses. For example, if we hit our leg, we instantly see towards the leg. This pathway will go to the tectum in the brain. On the back of the midbrain, there are two swellings. Upper swelling is called superior colliculus, while lower swelling is called inferior colliculus. Both of them together are called tectum. These three pathways, number 1, a laterospinothalamic pathway for pain and temperature, number 2, anterior spinothalamic pathway for crude touch, and number 3, tactile pathway for visual reflexes, go to the medulla and fuse together and make a bundle called spinal lemniscus, and from this point they will move upward together, pass medulla, pons, midbrain, and reach thalamus. Information from A delta fibers will end up in ventroposterolateral nucleus. Some of the fibers for slow pain will also end up in ventroposterolateral nucleus, but most of them will end up in Y area of thalami. It is a white matter lamina with some gray matter pieces called intralaminar nuclei of thalamus. Slow pain will also stimulate reticular formation, which is a mixture of gray and white matter extend in the center of the brain stem. Reticular formation is the main switch for cerebral cortex. It is responsible for consciousness. Reticular formation has strong connections with intralaminar nuclei in the thalamus, and through thalamus it has access to the cerebral cortex. Because of the reticular formation, all the lobes of the brain can respond to their respective sensations. Insula is between temporal and parietal lobe. Insular cortex is responsible for autonomic response to pain like sweating, tachycardia, and nausea. Between two parietal lobes there is a cingulate gyrus which deals with the emotions attached with the pain. Post-central gyrus does high-level processing of the information, like where fast pain is localized. Pain comes through A delta fiber. When it reaches the spinal cord, immediately second-order neuron takes the stimulation. When slow pain comes through C fiber, when it reaches the spinal cord, it gets taken by some multiple neurons and then transmit to the lateral side of the spinal cord. Because there were multiple neurons took the stimulation, the localization is difficult in slow pain. Second-order neurons are stimulated by substance P and glutamate. Other neurons like fast pain dorsal neuron at the same time, when they go upward, they discharge collateral. They connect to the second order neurons too with connection or connector neurons. If we stimulate the fast pain pathway too much, they will stimulate their connector neurons, and those neurons will discharge chemical to inhibit the second order neurons to sense the slow pain pathway. Example is acupuncture, laminin creams or massage. When we stop these, the slow pain will come back. It's called gating theory. Area beneath the thalamus, third ventricle, cerebral aqueduct has some neurons. Their axons come down and make descending pathway. These pathway goes to the big horn of spinal cord and release morphine-like neurotransmitters called enkephalin and endorphins to block out the pain. Spinocerebellar pathway takes the information from the body and through the spinal cord sent it to cerebellum. Information of the right side of the body will reach the right side of the cerebellum and vice versa. When information comes from the muscle or skin, it goes to the big horn of the spinal cord via first order neurons axon, terminate and second order neurons axon start, and then move back laterally and then move upward. On the way up, these fibers keep making nucleuses called dorsolateral nucleuses of Clark. Clark nucleuses is basically second order neurons. Medulla is connected to the cerebellum with inferior cerebral peduncle. Pons is connected to the cerebellum with the middle cerebral peduncle. Midbrain is connected to the cerebellum with superior cerebral peduncle. From Clark's nucleus, the fiber will move upward and through the inferior cerebellum peduncle, they will move towards cerebellum cortex. It's called dorsal spinocerebellum tract. Clark's nucleus goes from C8 to L3, while dorsal root ganglion are present from C8 to S3. So lumbar part or S part, the fiber have to ascend upward and join L3. Accessi nucleus cuneatus. Some nucleus on the upper part of the Clark's nucleus receive upper body information and their fibers also goes to the cerebellum via inferior cerebellum peduncle. It's called cuneo-cerebral pathway. Another pathway, their information is coming from Golgi tandem organ, muscle spindle and pressure receptors. Fiber enter in the dorsal horn of the spinal cord and from there they move contralaterally, cross each other and move up, making interior spinocerebral pathway. They enter superior cerebellum peduncle and then they cross and go to their respective cerebral cortex. This pathway is called interior spinocerebral pathway. Spino-olivary pathway. Information like proprioception, touch and pressure come to dorsal horn, cross contralaterally and move up and terminate at olives, from where fiber goes through inferior cerebellum peduncle to cerebellum. In spino-reticular pathway, fiber comes to dorsal horn and move up to reach reticular